The NHS has signed up to race quotas in a bid to win diversity awards. They want a proportion of ethnic minorities in every single boardroom. They're not winning any awards for healthcare. We've got millions on waiting lists. They spend billions of pounds each year compensating people for medical negligence. Half of maternity wards are ranked as inadequate or requires improvement. They were given an extra 10.6 billion quid by the Labour government, and they spent it all without delivering any real improvements. But what we really need as a country is more ethnic minorities on the boards of NHS hospital trusts, isn't it? Now, I think the idea that ethnic minorities are underrepresented due to racism is a complete joke anyway. Just looking at some NHS trust boards in the Northwest, which is where this diversity quota thing is being rolled out. Well, there's a trust in Blackpool. It's got a black man and an Asian woman on the board. In Bolton, there's a black lady on the board. The chair of the board is called Dr. Niruban Ratnarajar. The Stockport NHS Trust Board has 2 black people on it. I mean, I could go on and on. University Hospitals of Liverpool Board. Well, there are 2 people wearing a pride flag in their pictures there. It's like a form of diversity, I suppose, isn't it? I mean, in the NHS, in general, it's total lunacy to say that there's racism in the hiring process. So the NHS employs people from nearly 200 different nationalities. 82% of the British population is white, according to the last census, whereas just 74.3% of NHS staff are white. I mean, is there racism in the way the NHS treats its patients? Well, no. I mean, nearly 1 in 10 people using the NHS don't speak English and need a translator, which we give them, obviously. In fact, people needing a translator have reportedly skipped the A&E queue ahead of English-speaking Brits. In hotels full of illegal immigrants, there are NHS staff. Well, it's probably easier for them to see a GP, isn't it, than poor old Dorothy from number 42, who's paid her taxes all her life right here in Britain. And just look at this article, all right? We spent millions on care for migrants while some Brits waited 18 months for treatment. Where's the racism there? Where is it? Despite the Tories and now Labour trying to block the NHS from hiring diversity officers, they've just carried on doing it anyway. They're hiring diversity staff on more than double the wage of a junior doctor. Some of them are on around 100 grand a year. They're hiring diversity staff on more money than junior doctors. Just let that sink in.
My ward, I have different people, different cultural people, but we always go together.
We celebrate every different culture, like Black History Month, different festivities of different religions.
Yeah, that is an advert there for an NHS trust entirely based around how inclusive and diverse it is if you want to work there. So why do we need race quotas on NHS boards? Also, they can win some award. I think it's from the Anti-Racism Network. I mean, what even is that? One of the people quoted in the Telegraph article about this is a lady called Evelyn Asante-Mensah. So she is described as the current chair of the Pennine Care NHS Foundation Trust. She was apparently the chair of Central Manchester Primary Care Trust and then NHS Manchester over a 12-year period. She was on the board at Manchester Mental Health and Social Care Trust. She's a member of the NHS Confederation Black Leadership Network and was previously a commissioner on the Equality and Human Rights Commission. She's also co-chair of the BAME Advisory Group, and in fact she was awarded an OBE in 2006 for services to ethnic minorities in the field of health. Well, I'm sorry, but has she been held back by racism in the NHS and British society? It doesn't seem like it, does it? In fact, there have been potential cases of racism, like this one. A 9-year-old Jewish child was allegedly forced out of his hospital bed and made to sit on the floor by NHS nurses wearing Palestine badges. So maybe the NHS could be focusing on stuff like that instead. We have a health service that is obsessed with BLM, diversity, inclusion, racism, even painting ambulances with pride flags. I mean, honestly. But what about the stuff that saved lives, you know? The number of avoidable deaths on the NHS has increased. I think they should have one focus and one focus alone. Saving lives. Because at the moment, we are literally dying for diversity, aren't we? Let's get thoughts from my panel. We've got senior political correspondent at the Daily Express, Christys and Cowgie. We've got political consultant and former Tory special advisor, Laura McKevitt, and journalist Benjamin Butterworth. I mean, Laura, when you look at some of this stuff that's going on in the NHS at the minute with these, do we need to have the NHS signing up to race quotas on boards in order to win some kind of diversity awards, do you think?
I don't think you're ever going to find me supporting the idea of quotas in general, but what I do think it is important that we have a diverse workforce within the NHS, and that workforce be diverse right the way through the NHS. Throughout the history of medical care, both socialised and non-socialised, there has been a history of ill treatment, particularly of black people within medical experimentation about 150 years ago. There are poorer outcomes for black and ethnic minority people in healthcare in the United Kingdom in particular. I think diversity in hiring in the NHS is important. What I think is very silly is mandating quotas that will very clearly impact upon patient outcomes across the board, regardless of race. I think there needs to be a very clear overhaul in how managerial efforts are undertaken within the NHS in England, in Wales, in Scotland and in Northern Ireland, because don't forget we're dealing with 4 systems here, all of whom are guilty of this to some extent or another.
OK, Christian, when you look at the amount of medical negligence that they have to pay, the waiting lists, all of that stuff, I'm amazed that the NHS has the time to paint an ambulance in the pride colours or in this case, go around setting quotas for ethnic minorities on boards, really. I would have thought most people just want their lives to be saved.
Well, of course, people do want that. And what I think is interesting about this story in particular is that for once, we can't even blame it on Labour. Right? Wes Streeting is actually one of the more sound ministers on this, and it was just a couple of weeks ago that he was basically railing against EDI. So we've had a Conservative Health Secretary basically ban the NHS from doing this, a Labour Health Secretary not change that policy, and the NHS go ahead with it anyway. And I think the problem, ultimately, with all of these stories, lies in the Equality Act. They are mandated to hire these very, very expensive, well-paid equality and diversity managers who then have an incentive to make up work for themselves. I think that's why. And there's also, I think, an incentive that at the end of the day, it's probably easier to sue the NHS for racism than it is for medical negligence and killing granny.
I just think, Benjamin, to bring you in on this, I mean, the workforce of the NHS is probably, it has to be, doesn't it, one of the most diverse workforces in the world. I mean, we all know that anecdotally from going in there, being in the NHS. I mean, I find it ridiculous, the idea that we need more diversity in the NHS.
I mean, I was intrigued when you said they have almost 200 nationalities, and I thought, well, there's only
195 countries. I know, precisely. I thought that as well. The NHS, I think, has maybe invented countries.
No, they're getting tribal. They're getting tribal. That's what they're getting to the sub-level.
How diverse it is. But carry on.
Yeah, I thought they seem to have more nationalities than the world has nations, which is quite a feat. I mean, look, the real story today about the NHS, because you mentioned in your monologue that £10.6 billion extra went to the NHS. Well, today we saw the consequences of that, far more important than any of this, and that is for the last 4 months, waiting lists have been falling, which to do that during the winter, when normally there is a winter crisis, is extraordinary. 2 million new appointments have been created. That is what this Labour government has been doing.
Well, that's not anything to do with whether or not we need more black people or Asian people on boards of hospital trusts.
Well, and also just put this in context, since Labour came into power, 35 posts, according to the Daily Telegraph, have been hired in this realm, in this area. There are 704 hospitals in the UK and 1.5 million people work at the NHS across the UK. So it is a tiny proportion. And what that is intended to do is so that you don't have a situation, for example, where black women are 3 times as more likely to die during pregnancy than a white woman. That is a massive disparity. And clearly it's because something in their healthcare isn't adequate. And I think it is absolutely the NHS's remit to try and improve that.
I think it's really important to note that 2 million extra appointments is by comparison to a period where there was strike action across the NHS, and therefore it's not technically a direct comparison that works. But I do think another issue here, actually larger than the Equality Act issue, which doesn't actually mandate that you must spend X amount or create X number of posts. It has, targets you have to hit, but it doesn't say, and you must do this by spending X amount or hiring X number of people. What's more interesting here, actually, is the paranoia that governments felt for really the last 25, 30 years over losing health minister after health minister after health minister because of all the crises in the NHS. And so what they did was they created the concept of NHS England, which allowed, by virtue of being an entirely separate body, for a health secretary to create a rule that says you can't do this anymore, and for NHS England to just blithely ignore it.
And that's a key point. And I also think there's 2 things roll into one here, which is the value we put on diversity officers within the NHS as opposed to nurses, junior doctors, hospital porters, or all those other people. It's 2 or 3 times as much, it seems anyway, on paper for the salaries of it all. But it's also the sheer volume of it, and the fact that we now can have a government, and we see this all the time when it comes to immigration policies or asylum policies. We have a government, a democratically elected government, with a policy saying them to do this. But because we've got this woke blob who's in charge of a massive organisation like the NHS, they can just do whatever they want, Christian.
Yeah, exactly. And I think it sounds silly to say something like this is fueling the rise of populism. But I think this is a small example of why people are getting increasingly angry at the democratic system. It is clearly unacceptable that you've got a Labour Conservative consensus saying do not do this, and unelected bureaucrats are going ahead with it anyway, and ministers are clearly pulling levers that are connected to nothing. So what is the point of them whilst we're governed by the undemocratically, undemocratic blob? I just think it fuels that sense of frustration. You're right to draw parallels between this, between asylum, between immigration, and between everything else.
So half of maternity wards in Britain are apparently rated either inadequate or requires improvement, which is shocking. It's absolutely awful. I mean, it's
England. We've got to remember that we're dealing with 4 health systems and 4 different governments that are failing, because it's really important to hold all 4 of them to account on this.
But that is ridiculous. So I would argue that is a more pressing concern, Benjamin, for most people out there right now than whether or not an NHS trust in the North West creates a role for someone of a more diverse background on one of their boards.
But it's exactly the same question in some ways, because there are, as I mentioned earlier, there are much worse outcomes for black mothers, black women giving birth, than there are for white people. That would be the same question as what you're raising.
And you have to without having someone on the board. I mean,
because you have to ask. Well, hang on. If a doctor isn't trained on the differences, for example, some communities have much higher rates of diabetes, which affects their pregnancy process. We saw this during COVID, for example, with disparate outcomes for different ethnic groups. If you don't have doctors trained in that, aware of that, know what to look for, then you make those mistakes, and we make those mistakes on a massive scale. I mean, they're not bad doctors. They're just not. They don't have a ubiquitous knowledge.
Well, sorry, I think there are incredibly bad doctors. I mean, anecdotally for me, anecdotally for me, I went in more than a year ago and was told I had a hernia. Okay. And then now I forgot about the fact that they said to me, this will have to be operated on, because thankfully the pain went away, right? For whatever reason, I don't know what it was, but it's gone away. I got a phone call this morning with a voicemail thing saying, we can schedule you in for your surgery for this, which is in another 6 months' time. So that would have been, if I'd not forgotten about it, basically the thing that cured me was forgetting about getting care about the NHS
maybe that,
and clinging on long enough for me to have forgotten about the pain.
Well, maybe that was...
Just on behalf of the ovary brigade here, that's not an option with pregnancy.
No, it's not. No.
Very much a time-limited issue here. And I do think it's really important that maternal care, particularly in England, actually, is appalling across the board. There are worse outcomes between black women within the system versus white women within the system. Largely that is representative of worse outcomes for black people within the system as a whole. It is really important that maternal care across the board is improved, and a diversity hire onto a board is not going to do that. Wholesale overhauling of the maternity system in the United Kingdom across all 4 systems is what's required here.
I'm just concerned that this mindset that the NHS has will just lead to women of all colour receiving just as poor quality care, rather than actually focusing on outcomes for everyone, whilst there may not be a complete shutting down of this.
How can they say they're cash-strapped when actually they've got the money to paint ambulances in pride flags, or an entire hospital, I think it is in Bromley, has got a giant pride flag all over the side of it, all of this stuff. They some of the diversity officers, they do things like they spend money on art in the hospital corridors, specifically from people who happen to be of an ethnic minority background. I mean, none of this stuff is focused on the primary focus, which is getting people well, is it?
I think maybe your hernia delay was anti-Cypriot racism.
Well, maybe.
You can't rule that out. You never know. I think the real issue is the fact that the NHS has 2 million more appointments, and I find it amazing that you didn't mention that in your monologue.
Well, there we go. You mentioned it several times on the sofa, so fantastic stuff.